Okay. Good afternoon, everyone, and welcome to this webinar with Boston Mayor Marty Walsh. On behalf of the team at the Greater Boston Chamber of Commerce, I hope that people on this call are joining us feeling safe and healthy. But we realize that the reality is there's many people feeling some sense of anxiety and worry during this really two-dimensional crisis. One involving concerns about public health and another some stress about economic security. And, you know, here at the Chamber, we're hoping that we can provide some information, support, be a voice for the region's business community, and also be a convener and connector to sources of information that you need. And today is an example of that. We're very pleased that Boston Mayor Marty Walsh has agreed to join us for an update on the city's response to the COVID-19 crisis. I'd like to begin, however, with a thank you to our longstanding partner, Bank of America, not only for sponsoring activities like this, but also for the tremendous contribution that they've made here in the Greater Boston area and also nationally to help those in need during this COVID-19 crisis. I do want to also flag for our participants that this webinar is being recorded and will be shared on the Chamber's YouTube page shortly after the presentations. And finally, this session will end at 1:45 today. We'll have time for questions and answers. And please be sure to submit those questions on the feature at the bottom of your screen or submit via email to chamberprograms@bostonchamber.com. And with that, I'd like to introduce Boston Mayor Marty Walsh. As I've thought about the dimensions of leadership in crisis, there's really three components to it: a steady, calm hand, genuine compassion, and making good choices. And certainly our mayor here in Boston has demonstrated all three of those dimensions of leadership in crisis. Mayor Walsh, thank you for that leadership, and I'll turn the floor over to you, and then we'll get into some questions.
Thank you, Jim. I want to thank you and the Chamber and everyone on this call today. I want to thank Bank of America as well. Bank of America, Michael Chamberlain was the first person to call me about the mortgage relief efforts that Bank of America was going to do for Bostonians. And I want to thank Bank of America for being a sponsor today, but also for beginning that effort, and many other businesses have done since then. I'm joined here today with John Barrows, Chief of Economic Development, and Marty Martinez, Chief Health and Human Services. And I appreciate your accolades in the very beginning, but you can't do this alone. And I'm fortunate to have an incredible team around me that are doing amazing work. So I want to thank them too. You know, certainly a good organization is great people, and this is an organization, we have some great people here for the city working. So I want to thank them publicly. Just real quickly about some projections and numbers that we're seeing right now in Boston. And I know many of you already know this, but I might be repeating myself on some of the numbers. But as of yesterday, April 14th, we do not have the updated numbers yet. 28,163 people have tested positive for coronavirus. 1,296 were new yesterday. 957 people have died in Massachusetts, 113 deaths yesterday alone. In Boston, 4,286 cases. We're up 200 from the prior day. We have 84 people who've lost their life. That does not include Officer Jose Fontanez, who we lost yesterday. He'll be included in today's numbers, unfortunately. 547 people have recovered. 52% of all of our cases of coronavirus, and it seems like this has been going on for months now, 52% of our cases came between April 5th and April 12th. That means more than doubled in a week. The key here is for the next couple of weeks is flattening the curve, and we want to make sure. I'm having a little difficulty right here. I got the wrong way. Give me 1 second here. Oh, I got it. Okay, now I got it. All right, I got it going. Flattening the curve is really important in saving lives. So, you know, we're asking everyone, and people listening here today, you know, we're asking people to wear face coverings when they're outside. respect the citywide recommended curfew. That means from 9 o'clock at night till 6 in the morning. We're asking people not to be out unless you're essential personnel. We're asking people to spread the word. We think it's been working. It's going to be hard for us to tell for another couple of weeks. We recognize that we're still very early in the surge. Local projections show that we'll reach our peak near the end of April. So when people think this thing's over, it's not. It's why, the federal government talking about reopening the economy on May 1st is unrealistic. And quite honestly, I use the word irresponsible, but it's not right. You don't want to give people false expectations right now. We want to make sure that we keep people inside, keep people separated, if you will, physical isolation. And all of us on this phone have a responsibility to do that. We certainly want to get our economy back up and running as soon as we can. That's why we continue to work around the clock here to slow the spread of the virus and help our residents. We're expanding medical care capacity and supporting our healthcare and frontline workers. And we're taking precautions for our seniors and our vulnerable neighbors. We're working to support residents hit really hard financially as a result of this pandemic. And we're working with banks and mortgage lenders. It's been a very stressful time for our businesses, and I know that. When the stay-at-home advisory went into place, we worked to help restaurants who were at risk of losing their businesses. John Bars and his team created a support Boston restaurants directory for residents to see what's open and promoting gift cards, etc. We provided online listings and other ways for residents to find essential businesses that remain open. We immediately put in place letting every restaurant have takeout and delivery options so they can open during this emergency. We also, I spoke to the governor and making sure that the beer and wine legislation went through the legislature, and that was, I think, a help for some businesses, at least keeping some of their businesses moving. We created a financial relief book for FAQ documents and for small business, one-stop resources for navigating both public and private programs. We established a small business relief fund for local businesses in risk of shutting down. We received 3,000 applications for that. We continue to survey small business owners to hear from them directly about their needs. We're obviously going to try and do everything we can to help small business owners get access to new federal and state resources when they become available. And I say all this because it's kind of, we did it before the federal money came down, and the city doesn't have the means to be able to bail every single business out. But what we can do is offer information and advice on where we can get some money to businesses. We're going to do that. And as we continue to move forward here, we're working with our federal government officials. Senator Warren and Markey were really incredible as far as helping getting this relief package in our congressional delegation. So we want to continue to do everything we can. So we want to hear from a lot of you, the business team, the business folks listening on this, how we can support you during this crisis. The economic development staff has been incredible in this, working full-time around the clock. And any questions that you have, please make sure you ask them. I know that we have a couple questions here, Jim. You want to ask them and I'll answer them, or how do you want to do it?
Yeah. Let me kick it off, Mayor. You mentioned reaching the peak and going through the surge period. A number of questions because people want to get out of their house, they want to get back to work. Number of questions focus on sort of that period of time, and I know that you're focused on the now and keeping people safe. But as you think about that post-surge time period, what kind of conditions would you look for to begin to reopen things, and how do you see that sort of reopening taking place over time?
I think it's good. I think when we get to that point, it's going to be slow. I don't think we're going to start seeing everything happening at one point. I read a story today about question of Major League Baseball. Dr. Fauci was talking about, do you think Major League Baseball will play this year? And he said it could, but probably without fans. And I think that society is going to look very different for us for a while. When we hit the curve, and the curve is at the the most hospitalized patients we have, and probably the most cases we have at one particular moment. I can, Marty, correct me if I'm wrong here. But when we get to the top of this peak, if you will, to get to the other side, we're still going to have people testing positive for coronavirus. We're still going to be having the spread of the virus. It's just that it's kind of the maximum peak of the virus. It won't disappear. So I think as we think about going back to work, we have to be very cognizant of the fact of maybe starting with young people. And these are things that we're just having conversations. So I'm just having a conversation with you now. It's nothing that you shouldn't take it to the bank what I'm saying, but vulnerable people that have pre-existing conditions, we have to be careful of them. We have to be careful of how do we restart our schools. Do we go back to school before the end of the year, or do we wait till September? And when that happens, what does it look like? I think we're going to be really relying on data to see what data is telling us and how we move back. Our older population, we have a workforce that tends to be older workforce working in the city of Boston and in the Commonwealth. And the recommendations are the older workforce goes back last. And what do you do at restaurants? Do you open them up? You can't open them to full capacity. So I think as we start to move on here, I know there's going to be a lot of conversations. I know, Jimmy, you're going to run a conversation at the chamber. How does that look? The state, the governor has teamed up with governors from the northeast part of the country. I'm talking to mayors from around the country. I'm talking to mayors here in Massachusetts. And I think in the coming weeks, we'll have more consistent conversation and more information how we put out there. But I think it's going to be a slow roll back to work.
Yeah. Follow-up, you mentioned schools. Question about your thought process on whether or not this school year is over. And at what point do you think you have to make that decision?
I've talked to the governor. I talked to him 2 days ago. We talked about this issue. I know that the Secretary of Education is talking to different districts around the Commonwealth. I think that decision needs to be made fairly quickly. Right now, the governor's state of emergency, stay-at-home advisory, I should say, is in effect till May 4th. I see that extending the postponement of school, extending beyond that, if not a full cancellation. I would say that probably I'd say by, at the latest, early next week, we'll have to make a decision on that because parents need to make arrangements. And then there's summer school that comes after that, and there's summer jobs that come after that. So there's a whole host of decisions that have to be made here on how we move forward. I think the quicker we can do it, the better we can start focusing on what the plan is to return back to school, whether it's the end of this school year or for next school year.
And what are you hearing about the distribution of meals to the school children and the use of technology and remote learning?
Yeah, we've distributed since the beginning of this about 181,000 meals at our sites and some nonprofit sites in the city of Boston. We're delivering about 4,000 meals a day to families at home that have special needs, children that need help. We've distributed over 28,000 Chromebooks to the school kids in the city of Boston. I read the paper the other day, and there was like one story of supposedly not a good situation, but I was talking to somebody today that told me that their friends are in the Newton School District, and they love the fact what Boston's doing, and they're much more ahead of some certain districts. So I think overall, under the circumstances, our district is doing remarkably well in a lot of cases, and I think it's hard to judge them, but they're working morning, noon, and night to make sure that our kids are learning from home, making sure that our kids are getting meals twice, at least once a day, having meals for the kids and the families. And the services they need. We're also doing other things. When a parent shows up at a site, sometimes they not only go for a meal or technology, they have other issues. And we've been able to help parents not be evicted from their homes and have a place to live where they feel some comfort there. So we're helping with other things as well there.
Right. Continuing on the circumstances of return to work, a question about, we hear about the development of tracing technology, use of mobile apps, that sort of introduction to track individuals that either have had it or for other health reasons. Is your team focused on tracing technology?
Yeah, what I'm going to do, I'm going to ask Marty Martinez to jump in the seat here for a minute and answer that question if you have a couple other medical questions. Because
yeah, I'll do that.
I'm giving the answer I'm quite honestly making up. So I'll have you get the facts from Marty. Hold on, here he comes.
All right.
Hi, how are you?
Thank you.
So related to the contact tracing, I mean, absolutely. Obviously, the work of public health is central to the tracing and the contact tracing that we're already doing with our public health nurses, which we're still actively doing and engaged with 25, almost 30 nurses doing it right now. But we're also really interested in the access to technology, right? There's not only technology in terms of online portals and other apps being developed, but trying to make sure that you have a real hand on who gets the virus, virus, and then how do you trace their contacts? That's really how you contain it. So when we want to open things back up and we want people to be able to go back and do what they're doing, it's going to be really important that the public health system has a good handle on who's had the virus, who may still get the virus, and to the mayor's earlier point, after we get over the peak, people will still be getting the coronavirus. So we need to be able to do that. So we've been in conversations, not only with the state and their initiative, but also with some private entities who are looking at contact tracing in a much broader universe than just what we've been doing it in. So that's some of the work we've been doing around it.
Okay, I'm going to stick with you, Marty, for a minute for some of these questions that I think are really best for you. Question about how long does the virus survive on various surfaces? And the second part of that question is, people are going grocery shopping and they're doing their best, but how best to handle groceries when you get them home? And any other practical advice like that?
Yeah, it's a good question. So there's not 100% clarity in how long it lives on surfaces. There's anywhere between it living on surfaces for 4 to 6 hours, and then anywhere that lives on surfaces for up to 2 to 4 days. It depends on the surface. It depends on how the virus got onto the surface. And so that's why the real lesson is to disinfect, to constantly clean surfaces, to ensure that you're cleaning surfaces that are touched by multiple people. We're talking about doorknobs, tables, things that everyone's sort of touching in a household, and to make sure you do that. It's also why it's important that when you go out into public for essential things only, that's when people should be going, that people are sanitizing their hands and washing their hands and avoiding touching their face. You might say I'm holding my mask in my hand because I wear my mask when I'm out in public. So it's really important that we do that. In terms of grocery stores, it's really important that people, keep all those same things in mind. But in terms of products and goods and what people are buying in stores, there really isn't a concern around it as much as people might be thinking about. When you're thinking about bags or boxes or things that you're bringing home, lots of times we're reminding you that you should throw those things away, and then before you do anything else, you should wash your hands thoroughly, make sure you sanitize anywhere that those places were. But again, it's really important that we remember, sometimes we think about cleaning as just an afterthought in this entire ordeal, but it really is central to making sure that you can kill the virus by sanitizing surfaces.
Okay, one more for you, Marty. It's about the reuse of treatment drugs. This one specifically speaks to a person's father who was diagnosed with COVID-19 and was treated with, I may say this wrong, remdesivir. And, we hear the stories of other reuses for treatment. Can you talk about that in Boston hospitals and what kinds of reuses are being employed for compassionate care or as trials?
Yeah, absolutely. I mean, many of the hospitals are actively engaged in trying to figure out what kind of treatment they can provide folks who are really critically sick from the coronavirus. And so there are everything you can think of sort of on the table, whether it's, there's been versions of anti-malaria drugs that folks have utilized. There are even drugs around pain related to cancer treatments that folks have utilized. I'm gonna do my best to avoid specific drugs because, again, what we want to remind everyone is there's no treatment for the coronavirus. But what people have tried to do in hospitals is to be able to connect it to other mechanisms that we know that sort of deal with the repercussions of a virus, the way the virus plays out. Again, remember, it's an upper respiratory virus mostly. So the way that it plays out can have a great impact on the underlying health condition someone may have. So if you have a health condition of asthma, or you have diabetes, or you have heart disease, whatever you're using for medication for those diseases can be strengthened to be able to make sure that you're getting additional care for that underlying health disease. It doesn't actually make a tremendous impact on the coronavirus. But again, there's trials happening and all kinds of efforts happening in our hospitals all across the city and across the country to see how we can find a treatment. So that's sort of where we're at in terms of the healthcare system here.
All right, Marty, thank you for handling our medical questions. Okay, Mayor.
Can I just jump in what Marty said about the spreading of this? I know there's a lot of people listening today and a lot of millennials and young people. It's not okay to have people over your house at night drinking wine and doing that. It's not okay to have people in your house that that aren't your immediate family that you live with every day. Stopping the spread of this is so important. 40% of our cases that we've seen in Boston are people under 40 years old. 60% of our cases are actually 70% of our cases are under 70 years old. So young people can spread this thing pretty fast. So we're just asking you, as you're listening today to this webinar, I can't stress it enough that the need to be disciplined in this. Making sure you wear a mask, because Marty has one on. He does have it all the time. I have mine right here in my pocket. I have it wherever I go out of the house. If I go for a walk, I had it on the other day, walking down the street. I don't really go on the weekends. I do that. So it really is important to be disciplined in this. And also a second piece of it, your routines. Change your routine up. If your routine is to get up, watch the news all day, do some reading, and just stay focused, and you're not exercising, that's not healthy either. So you need to figure out what your routine is at your house. It happened to me Sunday. I woke up Sunday. I didn't come in City Hall Sunday.
Mm-hmm.
I had a call at 9, one call in the morning, that was it. And I basically it felt like I was in a funk by the end of the day, because I thought I was resting, and I really wasn't. So it's really important to stay active as best you can in your home, read a book, talk to people on the phone, whatever it might be, do Zoom calls and things like this.
Mm-hmm. Mayor, you may have just answered this question, but we've got a couple of questions when you did it and today about the purpose of the curfew at 9 o'clock to 6 a.m. What drove you to make that decision?
Yeah, the purpose was just basically talking to Marty Martinez and his team, and nothing, as they say, when I was back in the day when I was partying, nothing good happens after midnight. Nothing good happens after 9 o'clock. I mean, everything is shut down. There's really no reason to be out, unless you're an essential worker, and felt that it was really important to kind of reinforce the fact of keeping people at home rather than having a full shutdown kind of curfew here in the whole city, 24 hours a day. A little different in the daytime, but at nighttime, 9 to 6 a.m. We were originally going to 7 a.m., but we moved it to 6 a.m. because of senior citizens. Many grocery stores and stores have created special hours for seniors. So they obviously listen to the curfew, unlike myself and other people. So it was really for that purpose, to keep people in, because the virus, it doesn't know what time it is, so it can spread as easily around at nighttime. So really encouraging people not to be gathering socially.
Okay. A couple of questions about city budgets, financing, and operations. So yesterday we heard some pretty sobering projections at the state level about lost revenue. How will that affect the cities and towns, particularly the city of Boston, in your mind? And what's your thinking as you move forward with the fiscal 21 budget process? Well,
certainly it's going to, I think I saw a number as low as 20% budget reduction in revenues at the state. I was up there during 2008, 2002, 2008, 2010, 11. And it was a pretty bad situation. I think back then we lost, I think it was something like 12, 13% of the revenue coming into the state. We had to make drastic cuts as a state rep and take money out of the rainy day fund. I can't even fathom a 20% reduction as quickly. And on top of that, having to spend as much money as they are right now in response to coronavirus. So it's a really challenging time for all budgets, but the state's going to have a very difficult time, I think, moving forward here in the budget process. 13% of the money that we get to fund our budget comes from the state. And then we get obviously money for education and different parts like that. So we are looking at that to see what the projection would be. We're waiting to hear from the governor and the House and some consensus numbers, and they're still working on it. And I think those numbers are going to change in a month. But to come back to the city's budget, we had really plans for making major investments across the board in the budget. We were talking about we were making big housing investments and big education investments in public safety, a lot of investments in technology and infrastructure throughout the different departments. And a lot of that has been scaled back, if not completely eliminated in our budget. The first budget we put together was that beautiful budget that we're all excited about, and we're looking at revenues coming in, and we were really going to do some great things here in the city. When we submitted our budget, when I submitted my budget on April 8th to the Boston City Council, I don't have the exact number, but it had been reduced. Most of the increases and most of the investments we made have been taken out of it. What we did commit to continue on is the education commitment. We're going to make $100 million over a 3-year period, which I think this year is a $36 million investment to education on top of the cost. I could be wrong on that number, but I think that's what it is. I can fix that later. And then we created a housing voucher program, first of its kind, I think, in the country, the City of Boston voucher program. We're going to keep that program because the need for housing, we're seeing the need for housing right now, where 2 and 3 families are living together under the same roof. And if one person in that family gets coronavirus, there's a good chance everyone's going to get it. So the lack of affordable housing is hard for us. So we're going through the budget hearings now. The council's having the hearings. Hopefully we'll see how those hearings go. And I think the final budget will probably be different than the one they're working on right now. And I don't think we'll have a lot of submissions. I'm hoping, and I don't think we have to. We're not looking at layoffs and things like that. I heard the mayor of Vancouver was talking. I was on a conference call with him earlier today. He was talking about laying off people in Vancouver and the public employees, and they're cutting their budget back in a big way. I'm hoping we don't get to that point, but a lot of it's going to depend on what the recovery looks like and how quickly we get up and running. And I think that the real pinch that we're all going to feel in our budgets is it might not be this year, this fiscal year, but the next couple fiscal years will be more problematic for us.
Okay, a couple of questions about operations. Obviously people can't go into City Hall for the normal things that they might visit City Hall to do, licenses and other types of activities. How is that set up? How is it working? Have things gone virtual? Can you do many things virtually that you couldn't do before?
Yeah, most of the services now that we offer in City Hall are virtual for the time being. City Hall is open 2 days a week, Tuesdays and Fridays. You have to come in, you have to have an appointment to get something. So if somebody wants a marriage certificate or pay a bill or things like that, they will have to come in they have to make an appointment coming in. Everyone that comes in is getting their temperature taken. And if the temperature is high, obviously they can't come in. We'll want to, that includes staff that works here in the building. So everyone that comes into City Hall has to have their temperature taken every day. And it's, it's a different type of business, but we're constantly working. I get a weekly update from all our departments on what they're working on aside from COVID-19. They're still doing a lot of work. The BPDA is still having virtual meetings and conversations about projects. We have the zoning board that hasn't met now in a month, probably won't meet for another little bit of time, but they're working to make sure that the projects that can be lined up to move forward can move forward. Parks and Recreation still has crews out there. We had a bad rainstorm 2 nights ago and a lot of wind, so we had about 100 trees down in the city, so our crew is out there. Water and Sewer was fixing a water main break last night on Harrison Ave. 105-year-old pipe broke on us, burst on us, and we had to go back out, get out there last night. So there's still crews working, but as far as the building itself, City Hall and services like 1010 Mass Ave, you need an appointment.
Yeah. So a couple of questions about the whole development and construction process. Let's start with sort of the development and approval processes. You mentioned BPDA and in the zoning board. When or is BPDA approving Article 80 submissions and processing them? And you mentioned getting ready to open up and get these projects going when we can. Is that activity happening, or will it step up so we can be ready to open up construction?
Well, the board's out meeting right now, so we can't approve any projects, but what they are is working on projects behind the scenes. Many times that when you get to a board approval, you've gone through all of the steps, whether it's design review in here, architectural review in here, historical preservation review in here. A lot of that work is still going on. Very difficult to have a community process in this environment. You can't really get the greater community on a call or conversations. It's hard. Different people have different challenges with technology or just don't have the technology. So what we're doing is lining up a lot of projects on how we can, once we get going here, how we hit the ground running. I think it's really important for us that we get this approval, get the approval process or the denial process if they're denied, get this thing up and running as soon as possible. I think that's key here for the city and moving projects forward. On the construction side of it, we're planning on a call in the next few days with contractors to talk about what it would look like when we open construction up. We have an affidavit that all contractors, both general and subs, will have to sign. They'll have to put safety protocol on the job site. They'll have to put on and wash. A lot of these job sites don't have hot water and facilities to wash your hands. I mean, on the rough construction sites outside, you don't have it. You do in the buildings. So we're going through a checklist that we're going to be having a conversation in the next couple of days with contractors. We're looking at tentative dates to begin construction and a slow ramp up. But again, that's really going to depend upon the curve, the surge and the curve. I mean, right now the highest, they're saying we're going to hit the curve, I think is between April 26th and 28th. So we're going to monitor the situation. Certainly, I think construction is something I'd like to get back to work as soon as possible. We also have older workforce in construction in some places, so we want to be cognizant and make sure they have the proper safety equipment. What I envision is large construction projects. Maybe we suggest they do 2 shifts, 7 to 3 and a 3 to 11. I think right now the way it works in Boston is you get a 5-day. You can work for 5 days, and you have to ask for approvals for the 6th and 7th day, Saturday and Sunday. We might look at doing a 6-day, allowing 6 days without asking for approval on Sunday. Making sure these companies, when we have the phone call with them, they have the proper equipment. So we're some inside City Hall, there are definitely people having conversations and thinking about what does it look like when we come back to work.
Okay, Mayor, in your press conference today, and really since this crisis began, you've been talking about the disproportionate impact of the pandemic on minority communities, certainly small minority businesses and people of color that are affected by the health impacts of the coronavirus. I know you set up a task force. Can you talk a little bit about your efforts on this score?
Yeah, what I'm going to do is let me just give you a couple numbers that I have off the top of my head. Then I'm going to ask John Barnes to talk a little bit about the task force. Him and Marty have been leading the way on that. Just for people to understand, we have 84 people that have lost their life in Boston as of yesterday. 33% are white, 32% I believe are black, 17% are Latino, like 10% Asian, and then there's 9 others in the different, not necessarily defined. We're seeing in our neighborhoods like East Boston, Hyde Park, Roxbury, Dorchester, higher rates of coronavirus cases. You can assume while some of those neighborhoods are higher, some are immigrant communities, there's language barriers, families, multi-generational living in the same apartment, and looking at how do we fix that information. All this information, by the way, is online. We don't have 100% of the numbers because some testing facilities aren't capturing that data. So it's roughly between 62% and 84%, depending on where the information comes from. So we're doing everything we can. Also, there's been a health disparity in communities of color. So when we see numbers of African-American men higher than what it should be, certainly we want to make sure that we jump in and see what the situation is there. And that's kind of what the task force is all about. So I'm going to just turn the floor over to Marty Martinez and then maybe John, and then they can talk a little more about the task force.
Okay, thank you, Mayor.
Thank you, Mayor. So the mayor created the COVID Health Inequities Task Force, which is made up of, medical providers, community health centers, and community leaders of color, really lifting up some of the issues that are specific to the needs of the community. So with the disproportionate impact that the mayor sort of articulated that the data has shown us, there's no question that targeted needs exist. And that's what we've started to do already. So it was formed about maybe 5 days ago. It's already had one meeting this last weekend. We'll have another one tomorrow, and have been focused on sort of 3 big buckets. One, greatly expanding testing in the community in those targeted neighborhoods and communities, which is critically important that people get tested. 2, community mobilization to make sure that our messaging and our efforts really reach those communities that have the highest percentage of cases and also seeing the disproportionate impact. And then the 3rd bucket is data. We've been releasing data. We've been lifting it up as transparent as we can be to make sure we can understand and that everyone can understand what we're seeing, so that we can sort of not only develop real strategies for it, but lift up the realities that exist for some of our communities in terms of our frontline workers and folks that are at risk because of the nature of their work or the nature of sort of what's happening in the community. So that disparity task force has been critical, and we're just getting started, but we're moving very quickly on action. I'm going to turn it over to John Barrows, who I think is going to bring up a little bit around the small business piece that we're also seeing.
Thank you.
Thank you, Chief Jim, good to be here with you. Chief Martinez talked about some of the impacts in the public health space and 3 buckets we're working on. The other area that's of great importance is the financial impact and the disparities that we're seeing through the financial impact. So the small business community, the mayor asked us very early on to dissect the small business community, take a look at what the demographics were telling us. And clearly in the micro businesses, most of them are owned, in fact, by people of color and immigrants. And so in looking at some of the responses, we talked to banks, we talked to HUD and some of the other federal agencies, and it was clear that we needed to provide the smallest businesses in Boston relief immediately. So we stood up the Boston Small Business Fund. And that is a fund targeted to small businesses with less than 35 employees, making less than 1.5 million in total revenues. We received 3,000 applications. In fact, 52% of those applicants were minority-owned businesses. 45% of those applicants were immigrants, self-identified. And we are trying to make sure that we are ahead of them shutting down for good. As you know, even in the restaurant bar sector of our economy, people are predicting 25% or to 50% of those businesses will not be able to reopen. So we're trying to make sure that we can assist that. The mayor lifted a number of regulatory permitting processes such as takeout. Now, all of our food businesses can do takeout. It's a way to try to make sure that they have a lifeline. It's an essential service that we need, but it's also a way to keep our small businesses going. Mm-hmm. It's an area that we're focusing greatly on. The second part of economic disparate impact that we're looking at is, of course, unemployment benefits. And so many of the industries that have been hit hard have disproportionate representation of people of color. Hospitality, food being the top industry impacted by the COVID crisis. The mayor has made sure that our office is well equipped with information and providing information to communities and doing outreach to make sure that those most impacted have the kind of information that they need. We host a weekly conference call with small business owners, and unemployment insurance consistently comes up. We understand that it's important to include, and we're glad the feds included the 1099 contracted workers, the gig workers, the independent contractors. But we also know that they are not being processed yet. So we're working hand in hand with the state to provide that kind of information. Don't be discouraged. That will happen by April 30th. That kind of information, that kind of connection with government is really important for those workers.
Thank you, John. And thank you, before you go, for the communication with your office. It's been just fabulous between the business community and your office over the past month, and I really want to express my gratitude.
Thanks, Jim. Thanks for your partnership on that. Couldn't do it without you.
Thank you.
And Jim, I just want to jump in real quick. You know, John talked a lot about the micro businesses and most of those being businesses of color. And I know that compliments don't get thrown out a lot around City Hall, but a lot of foundation work has been done in the last 5 years with businesses of color and kind of pushing to get more people into entrepreneurship. And what I'm concerned about right now is that all of these small businesses that eventually would become our larger businesses might not come back and might not survive. So I think that as we start to think about a recovery effort, and I don't like talking about it, but as they start to think about a recovery effort, economic development is working on plans as well to make sure that we don't lose momentum, and working with organizations like Beckman, making sure that we continue to thrive and move forward, and reaching out to folks like, you know, Pratt Wiley at the partnership, and making sure that these organizations are at the table, because I think that, like any crisis that happens in any economic crisis, there's always wreckage from that. And right now, even though this wreckage might not be long-term for most businesses, or for some businesses, it's going to be bad for some. And these smaller businesses, these small businesses of color and women-owned businesses might not come back. And we have to do everything we can so we don't lose momentum. And I think we were gaining momentum here in the city. And I know the Chamber was too, Jim, with all your efforts and what you've done on diversity. I think that we have to probably, when we get out of this, just be patient with each other and come up with a good, solid plan how we move forward.
Right. Mayor, some questions about commuting as part of the recovery effort. You know, yesterday or earlier this week, reports about T-ridership being in single percentage digits these days. Not a lot of commuting going on. But
many delays either, though.
I'm sorry?
Not many delays either.
Yeah, no. But people...
I was kidding, State. I was kidding. Don't write a story about that.
you know, people are going to have to feel comfortable and confident when the decision is made to come back to reopen and take some of the restrictions off. What do you think I know this is a state authority, the T, and much of transportation network is state, but what do you think of the conditions, or what do you think the kinds of things that need to be done to give people that sense of comfort that it's okay to take the T or an Uber or something like that?
Yeah, well, I'll tell you, for the T, right before everything got shut down, Steve Poftak and his team were cleaning the stations every couple hours. We saw them down there. Obviously, there was always that report of a station that hadn't been cleaned, but they were doing a lot of cleaning around the MBTA, and I think that they certainly will have a system set up as ridership begins to increase here on the MBTA. Eventually, they'll have a system in place to sanitize and keep the T clean. I know that they're working on that. And Steve Poftak, the general manager, has been talking to Chris Osgood, my chief of streets, and on a constant basis about coming back and how does it work. Uber and Lyft, I can't really speak to that. We don't have the ability in the city of Boston to regulate what they're doing. That regulation all happens at a statewide level. We have the ability to regulate cabs and inspect them, which we do. And I know cabs are working on a system when they come back as well. But I think we're going to be, as I said earlier, we're going to be living in a whole new world when we come back, when work goes back in session here, if you will. It's going to be a whole new world. And I think that the expectation by the public is going to be extremely high. I think most people understand today the severity of the coronavirus, and they understand the impacts of it. They're going to know somebody who either had the coronavirus or somebody who might have lost their life due to the coronavirus, or just one person removed. So I think that the expectation by the public is going to be far different when we come back to normal life here, as far as cleaning and maintenance, and whether it's Uber or Lyft, even our own fleet. We have our senior shuttle, we have BCYF, community service vans, our police department. So we do a lot of transporting as well.
Yeah. So Mayor, I know you only have a few more minutes, and today is One Boston Day. It's a day that's very special to you, not just as mayor, but I know on a very personal level. You spoke about that in your press conference earlier. So talk about two things. One Boston Day and your message to the city of Boston, along with ways people can help. I know you've set up a number of funds, and maybe people on this call might want to make some contributions.
Yeah, I was going to start the call with One Boston Day, but I guess it's the appropriate way to end the call with One Boston Day. I was not the mayor in 2013 when the bombing happened. I became the mayor in 2014. I just said this a little while ago on the press conference. And my first year as mayor, I knew that when I got sworn in January, I knew that April was going to be a time for me to have to do the 1 year anniversary. And leading up to it, I was nervous, and I started to think about April 15, 2013, and what transpired in that year. And, at that point, 4 people had lost their life due to this. Martin, Richard, Lindsay Lou, Crystal Campbell, and Sean Collier. Dennis Simmons hadn't died yet. He died in 2017 as a result of the marathon. But I got the chance to know the families. I think it was marathon. It was the 15th, the 1 year anniversary. And I hadn't met all the families who lost loved ones. And I was at the Parliament House myself, and at the time, Governor Patrick. And I knew the Richard family, but I didn't know the other families. And I had a chance to meet them all. And I was sitting there in the Parliament House, looking at them and understanding and realizing how strong they are. And we left the Parliament House later that day, and we went to the two. There weren't markers at the time. The 2 bombing sites. And I was with the families, and I was just wondering what was going through their heads. And I realized at that moment that the day after the bombing, Boston rallied around the survivors and the families who lost loved ones. And that first year, the families rallied around us as a city and lifted us up. What One Boston Day means is a day of giving and friendship and doing acts of kindness. And we're not able to do it this year the same way. But this year's One Boston Day is a little different. This year's One Boston Day can be as impactful, if not more impactful. But by social distancing from people, by making sure that you're doing what we're supposed to do to stop the spread of the virus. We can literally stop the virus in its tracks so other people don't have to lose their life. And we have an obligation. And those of you that want to, if you go on the website, it's what's the website? No, it's the other website. There's a One Boston Day website.
OneBostonDay.org.
OneBostonDay.org. OneBostonDay.org. onebostonday.org. If you go on that website, you'll see a checklist. And we're asking you to do 5 things on that checklist today. That might be just calling somebody, making a donation, buying a gift card from a restaurant. If you can do 5 things on that, I think there's 700 or 800 people on this call right now. If you do that, the impact that you'll have on people's lives can be multiplied 4, 5, 6, 7, 8, 9, 10 times. So that's all I ask you to do today. And just remember, everyone on this call, we're strong people. We're resilient people. We're going to get through this. We're going to be strong. And today it really is about being Boston strong. So thank you very much.
Thank you, Mayor Walsh. Thank you, Marty Martinez and John Barros, also for pitching in. I want to express the gratitude of everyone on this call. Please go to oneboston.org, as well as the mayor's site, City of Boston site. There's ways to give to the Resiliency Fund and other ways that you can pitch in. So please do that. Before I close the event, I want to highlight a couple of upcoming events. Thursday, April 16th, we'll hear from leaders at Google on creating and maintaining a culture of psychological safety at work. Friday, April 17th, we'll be joined by people from Harvard Business School and WorkHuman to learn how to successfully manage a remote team. And on April 21st, we'll convene a panel to discuss the impact of existing health disparities on communities of color and efforts to help mitigate these effects during COVID-19. You can check these out and all of our programs and events and additional information on bostonchamber.com. Once again, Mayor Walsh, thank you for your leadership in this crisis and for joining us here today. That concludes our session, and we'll be signing off.
Thanks, Jim.
Thank you.